Good evening, I'm Adrienne Arsenault. We've all been hearing that important message, stay home. And so, again, tonight I'm coming to you from my back deck, social distancing at work with Andrew back in the studio. Whether we follow that message is crucial, with nearly half of Canada's COVID-19 cases contracted in the community.
It's the calm before the storm, and the storm is coming.
I'm Andrew Chang. Also tonight, the battle over Canada's coronavirus relief package.
They could define the crisis however they want and pretty much come up with any excuse they're looking for to spend more. We continue to say hell no.
With $82 billion of financial help at stake.
My first symptoms had started on my way to the airport. At that point, are you really gonna, turn around?
How sick passengers are boarding planes back to Canada.
And we may be apart, but we're not alone.
It definitely feels like we're part of something bigger here.
How isolation is showing Canadians we're all in this together. This is The National.
Every day, we all lean in to see how many new cases of COVID-19 Canada adds. But tonight, it's not just the numbers that worry, it's how we got here.
Yeah, health officials say about half of Canada's nearly 2,800 cases are the result of community transmission. At the start of this outbreak, it was mainly travel that was to blame. Today, we learned 3 more Canadians have died of this virus. Quebec and British Columbia both saw a spike in cases, and those are just the people who have been tested and confirmed. The real count is likely much higher. Now, Parliament was expected to pass the COVID-19 aid bill today, worth tens of billions in financial assistance to struggling Canadians and businesses. But as David Cochrane explains, things did not go as planned.
It was all supposed to be so easy, but nothing these days goes as planned.
I would ask that you suspend to later today.
The plan was simple. All parties would come together to unanimously approve the aid package, $82 billion in financial support for Canadians and companies hurt by COVID-19. But the Liberals slipped extra powers into the package to allow for significant spending decisions without parliamentary oversight.
It is an exceptional situation that requires extreme flexibility and rapidity of response by governments to be able to help Canadians.
So politics flared up in the middle of a pandemic. The Conservatives refused to approve the package unless the Liberals dropped the power grab.
We could very quickly pass the assistance. We could take those off and get that passed right away.
The NDP said drop the surprises, vote on the aid.
Every moment that we delay is going to make it harder for Canadians.
The Bloc offered a middle ground, let the Liberals have the powers, but only until September.
Like many other governments throughout Western countries, the government should have such rights, but for a shorter period of time.
And so what was supposed to happen quickly led to marathon negotiations behind closed doors. $82 billion in aid hanging in the balance. So, Andrew, we've been getting reports from inside those talks of progress all night. Well, now some actual signs of progress. The Liberals have rewritten the legislation to address the opposition concerns, and just some recent minutes ago, that draft legislation has now been shared with the opposition parties, and it's being reviewed. Our expectation is that the Liberals will get the authority to do emergency health spending until September 30th without parliamentary oversight. That's not everything they wanted, but that is a compromise that will satisfy the opposition and will let that aid money get out the door. Now, all of this still needs to be debated in the House of Commons. There still needs to be a vote, but some late movement after a day of long delays.
So as we mentioned, the number of Canadian cases rose by at least 700 today. Quebec has the highest number of cases in the country by far and saw the biggest jump today with 385 new ones. British Columbia added 145. That crucially is from over the last 2 days. Ontario confirmed another 84 cases. But along with a rising number, something else has changed dramatically about these numbers, where people caught the virus. Here's Christine Birak.
The coronavirus is now spreading widely across most of the country. Yet again, Canadians are bluntly being told, stay home.
I can't emphasize how important that is. If we're going to get a handle on community spread, everybody has to respect those measures.
New numbers reveal a changing picture of who's infected. Travelers and their close contacts used to make up the majority of cases. Now, nearly half of the Canadians who've tested positive for the virus became infected somewhere in their community, usually in group settings.
In British Columbia in particular, we know quite a large proportion of these are related to long-term care facility outbreaks.
The same goes for care homes in Ontario and Quebec. Other clusters have been traced back to a curling club, funeral homes, and several people attending a dental conference were also sickened.
I don't think we appreciated how quickly it can spread across communities.
A new study examining the Diamond Princess cruise ship suggests more people might be spreading the virus than originally thought. Researchers found almost 1 in 5 passengers who had the virus showed no symptoms and may have been infecting others.
If you could envision a world where we all stayed in the same place 6 feet away from somebody else for the next 14 days, then the virus would die itself out and the outbreak would end.
That's not going to happen, but doctors say it's time for everyone to act.
I don't think we can hope. I think we do need to overreact, because if we look anything like Italy or what the United States could look like, I don't even want to imagine that.
Health officials say the next few weeks are critical and may ultimately decide how many lives end up being touched by this virus. Christine Birak, CBC News, Toronto.
Okay, I want to bring in Dr. Alison McGeer, an infectious disease specialist with Mount Sinai Hospital in Toronto. And Dr. McGeer, given the cases that we know about, is there a way to estimate how many actual cases there are in Canada? I mean, how big the problem actually is?
Well, it depends on how you define problem. So public health is getting data on how many people are hospitalized, how many people are seriously ill. So that's one element of the problem that you can measure. But still, we have this very significant issue that we don't know what's called the asymptomatic fraction is. We do not know how many people there are who are either don't have any symptoms from this or who are very mildly ill. And because of the issues with testing, which is nobody's fault, it's called the virus, okay? We don't yet have the capacity to answer that, and we simply have to be patient about that. It is critical. It's making life very difficult for people making decisions not having that number, but there's nothing we can do at the moment except wait for us to be able to expand the testing capacity and to figure out what that number is. It's going to take time.
Okay, and Dr. McGeer, I know we have many more questions for you a bit later in the program, so don't go too far. Thanks so much.
So you heard Christine Birak mention a dental conference in British Columbia. Well, it's been linked to more than 24 COVID-19 cases. And now one of the dentists who attended has died. As Tina Lovegreen tells us, that has some of his patients upset and very concerned.
The door to Dr. Dennis Vincent's practice has been shut for over a week now. News of his death just reaching his patients.
You went to see him and he asked about you. He truly cared about human beings.
Friends say the 64-year-old was in great health and enjoyed skiing with his 2 boys.
He never missed a day of work. I missed more than he did in those 2 and a bit years that I worked with him.
Vincent, along with 15,000 people, attended the Pacific Dental Conference in early March. 10 days after the event, health officials warned attendees to self-isolate after a cluster of COVID-19 cases were traced back to the conference.
We know of 32 people who became ill after attending that conference here in BC, and all of those were investigated by public health. I don't know the cause of death of this individual.
The coroner is investigating whether Vincent died from COVID-19, but friends say in the week before his death, he was showing symptoms and getting worse. A friend who saw him for dental work after the conference is wondering why no one alerted him about possible exposure as a patient.
I'm feeling very, I'm feeling very careless myself for having gone. Like I'm really, really concerned about that. The good thing is that I'm not feeling sick at all.
Health officials maintain those who needed to be contacted have been.
He was an awesome member of this community that's treated countless families that we know and he will be missed.
Meanwhile, his patients are just stunned by the news that their favorite dentist is gone. Tina Lovegreen, CBC News, North Vancouver, BC.
So controlling the spread is absolutely important. At midnight tonight in Ontario and Quebec, the deadline for the strongest measures yet to close businesses and keep people at home. But Ellen Morrow looks into concerns that Ontario stops short.
There are a lot of questions regarding what can and cannot remain open.
One question, whether Ontario's closures go far enough.
That list can be adjusted, and we will not hesitate to shut down further workplaces as needed.
Along with grocery stores and pharmacies on the essential list are dry cleaners, office supply stores, hardware outlets, and others.
I don't know how we're preventing anything.
Across Canada, more needs to be closed now, says Jennifer Tomlin, an ER doctor on the front lines of the COVID-19 crisis.
We don't want people to panic, but they should be a little scared. There is community spread now. We know this for a fact. You have to assume that every single person you come into contact with is positive.
Quebec and PEI have also ordered non-essential businesses closed. One difference, construction sites, mainly closed in Quebec, mainly business as usual in Ontario.
When it comes to necessities of life, shelter is at the top of the list.
But workers are anxious, says this union official.
We heard concerns for general hygiene, ability to wash hands, availability of hand sanitizer. Our members are crammed into those locations.
Premier Doug Ford says labor inspectors will be on site.
If the industry does not take every step necessary to look after their workers, I will shut them down.
Shutting more down is the only way to slow down the virus, says Tomlin.
We're scared. We're worried. We're worried on numerous fronts. If you're not afraid of what's going on, then you don't have a good understanding of it.
And to eventually return to normal life, she says, stay home now. Ellen Morrow, CBC News, Toronto.
Now, clearly, different provinces, different strategies to manage the virus. Anita Bath is tracking stories from communities across Canada for us.
Andrew, let's look at BC this hour. No new deaths have been reported. The total is still at 13, but cases have spiked significantly, 145 in the past 2 days. The chief medical health officer is trying to reassure people that BC is not on the same trajectory as Italy.
We've also put in measures at a point in time that is quite different from when they put in measures. And, you know, I really do believe that our, like the US as well, our testing strategy early on helped us better understand what was happening in our community.
2 new residential care homes have detected coronavirus cases: Little Mountain Place Residential in Vancouver and Evergreen Heights in White Rock. Most of the cases in BC are in the coastal health region, but the virus is moving quickly throughout our province. 173 people have fully recovered. That's almost 30% of all of our cases. Now, over the weekend, British Columbians were slammed for being out and about, not practicing physical distancing. But today, the beaches are bare, the White Rock Pier closed.
It certainly looks like things are improving, especially compared to some of the images that we saw from the weekend, where people were certainly not social distancing.
And just a final note, BC parks have suspended all services and closed facilities to discourage people from hanging out. The temporary measures affect marine parks, visitor centers, playgrounds, washrooms, and day use facilities. Andrew?
Thanks very much, Anita. CBC News has looked into the government's new measures to prevent sick people from boarding flights to Canada. They amount to simple questions asked by airline staff, and some infected travelers are hiding their symptoms and flying while sick. Dave Seglin spoke with one of them.
The pressure is on to get home. Canadians abroad are on the move, including people who are sick.
My first symptoms had started on my way to the airport. And, you know, at that point, are you really gonna, turn around?
This student fell ill in Spain. She admits she hid her symptoms when she boarded a flight home to Toronto a week and a half ago. She's since confirmed it's COVID-19.
If they didn't ask you, it wasn't information you volunteered. So I just stayed quiet about it.
Health officials are now tracking everyone she came in contact with. And last week, the government pledged tougher screening for air travelers.
Anyone who has symptoms will not be able to come to Canada.
But it doesn't appear to be working. Jane Salhani and her husband were on vacation in Spain, but cut it short and flew home Sunday.
One woman coughed for 9 hours. Basically, it was a 9-hour flight. She coughed the entire time, and everybody was very uncomfortable.
Transport Canada's new screening is just 3 questions asked by airline staff. Do you have a fever and cough? If so, you'll be denied boarding. Do you have fever or difficulty breathing? Have you been refused boarding in the past 14 days? If yes, you're denied boarding. All of it's voluntary, requiring honesty from travelers.
I guess people have to be honest or not, and say, yes, you're feeling well, you're not feeling well. I certainly empathize with anybody that's probably not feeling well, because you don't want to get stuck in that airport. Like, what would you do?
It has flight attendants and their union calling for individual testing of passengers to better protect everybody on board.
I've gone through different countries that they take your temperature prior to getting on. I think more needs to be done that way if we're going to take it seriously.
We found other countries are taking passengers' temperatures and using thermal scanners inside airports. For now, the Canadian government is ordering airlines to simply ask questions. The airlines say they have barred some sick travelers from boarding, but they won't say how many. Dave Seglin, CBC News, Toronto.
The World Health Organization is concerned that the United States could become the next epicenter for COVID-19. Confirmed cases have passed the 50,000 mark across the country, and at least 700 people have died, more than 100 of them in New York City alone. The CBC's Paul Hunter has more on the dire situation there and the tension between New York and Washington.
For a sense of the frustration in New York, consider that on the day U.S. authorities delivered 400 fresh ventilators to a new makeshift hospital in Manhattan, the governor underlined what's actually needed is thousands more.
You picked the 26,000 people who are going to die because you only sent 400 ventilators.
Says the World Health Organization, the U.S. may soon be the outbreak's epicenter, with New York the hardest hit region. Meanwhile, with the U.S. economy also under fire, millions now at home, Donald Trump today signaled he wants people back at work soon, remarkably by April 12th.
I would love to have the country opened up and just raring to go by Easter.
That the end of social distancing would come so soon is in the face of all those who insist that would only deepen the crisis. Said Trump, keeping the economy shuttered is worse.
You're going to lose a number of people to the flu, but you're going to lose more people by putting a country into a massive recession or depression. You're going to lose people. You're going to have suicides by the thousands. You're going to have all sorts of things happen.
Trump later seemed to hedge, suggesting reopening maybe just parts of the U.S.
I think that's a goal that perhaps can happen, or at least for a very large portion of our country.
His top scientist on corona then seemed to qualify the timing.
That's really very flexible. We just had a conversation with the president in the Oval Office talking about, you can look at a date, but you got to be very flexible.
And tonight, a sobering warning for all who've even been to New York lately, but who've since left. The infection rate there is so high, says the White House, that wherever you are, self-quarantine now. Paul Hunter, CBC News, Washington.
While the world anxiously awaits a treatment, some are turning to untested medication that could put their lives at risk.
Yeah, within 20 minutes, dizzy, hot. I started vomiting.
Coming up on The National, the warnings from health officials.
And the doctors answer your questions, including which is safer, public transit or taking a taxi or an Uber?
And coming together in isolation. A new shared Canadian experience. We're back in 2 minutes.
Welcome back to our special coverage of the pandemic. In Spain, the situation is getting more dire by the day.
We don't have beds, ventilators, staff, protective equipment. I'm just finishing a 10-hour shift. Look at me. Look at my tears. Please, stay at home.
This is a glimpse inside hospitals in Madrid. There aren't enough beds for these patients. The country has nearly 40,000 confirmed cases of COVID-19. That's the fourth highest in the world. Moreover, nearly 3,000 people have died there. This ice rink is now a temporary morgue. Bodies are being transported here by an emergency military unit to ease the burden on hospitals. And this is what it looked like in New Delhi today. These streets, normally crowded with people and vehicles, now quiet. The Indian government has imposed a 3-week lockdown on the entire country. That's 1.3 billion people banned from leaving their homes. India has about 500 confirmed cases of coronavirus, but researchers are warning that could balloon to well over 1 million by mid-May. Similar restrictions are now in place in the UK, too. Britain now has more than 8,000 cases, and the Prime Minister is being clear. People must stay home. Margaret Evans has the latest from London.
Still life in the British capital. The UK trying to slow itself down and bringing with it a sense of distortion, difficult for people to get used to. This is just day one of a lockdown the government warns will last a minimum of 3 weeks. Gatherings of more than 2 are now forbidden, and Brits should be staying home except for essential shopping for food or medicine, for one form of exercise a day, or to get to and from work, if absolutely necessary. If people don't, warns the government, the country's National Health Service will be overrun. Today, the Health Secretary announced plans to create 4,000 new hospital beds at an exhibition hall in London, where the most coronavirus cases have been reported so far.
Yesterday, the Prime Minister announced the most radical steps yet to slow the spread of this virus. And these steps are not requests, they are rules.
The lockdown measures bring the United Kingdom more in line with European countries like France and Germany. But critics say Johnson should have implemented them sooner.
Having seen what happened in Italy and having seen what happened in Spain.
Bike shops are one of the few businesses allowed to stay open, now considered an essential service here.
For the key workforce, because if they want a bicycle to go to work, we're able to help them. We're able to fix their bikes.
Stand well away from the doors. Do not
These were the scenes on the London Underground this morning. People crammed onto a reduced service, even though it's meant for critical workers only, many of them in healthcare. It's led to a row over whether construction work in the capital should be shut down. More uncertainty, feeding a creeping sense of alienation as the country tries to slow itself down in order to live again. Margaret Evans, CBC News, London.
The Tokyo Olympics, the world's biggest sports holdout, has finally succumbed to COVID-19. Despite the personal cost, athletes had joined health officials in demanding action from a dithering IOC. But today, March 24th, the games set to begin July 24th were officially postponed. Sasha Petrusik has the details from Japan.
Just as the tower is Tokyo's landmark, this summer's Olympics have become a symbol of the havoc left by the pandemic. On hold, possibly until next summer, says Japan's Prime Minister Shinzo Abe, after a phone call with the International Olympic Committee.
And came to the conclusion that in order to safeguard the health of the athletes and everybody involved in the Olympic Games, that we have to postpone.
The flame, he says, will stay in Japan as the light at the end of a dark tunnel.
Training in canoeing racing.
That's welcome news for Canadian canoeist Laurence Vincent Lapointe, who's just cleared her name after being suspended for taking a banned substance. She dreams of gold.
And now that we have that much more time, I feel like it gives me the time to just breathe and do it properly and do it like get myself ready mentally, emotionally, physically.
In many ways, it was athletes faced with the hurdles and risks of training in a pandemic who drove the IOC to this decision.
The fact that there were athletes saying we will not go, it will result in a way for athletes to involve themselves more fully in the decision making of the IOC.
In Japan, it was the public who pressured Abe's government to delay, even if it jeopardizes Tokyo's $12 billion investment. The decision does raise a lot of questions here. Can this massive organization simply be put on hold? Will suppliers and sponsors wait? And for the athletes, will they have to re-qualify for the first Olympic Games ever to be postponed? Sasha Petrusik, CBC News, Tokyo.
Well, we've been getting many questions coming into our newsroom from you, the viewer, about the coronavirus, including this one about cash and whether it's safe to handle right now. The answer coming up after the break, but first. Prime Minister Justin Trudeau is using Instagram to promote his urgent stay-at-home message with a little help. Here's Canadian actor Ryan Reynolds.
It's the celebrities that we count on most. They're the ones who are going to get us through this.
In Italy, leaders have no time for jokes. They're too angry. Ping pong is not allowed, shouts one frustrated mayor. Go home to your PlayStations.
Siete degli irresponsabili.
You are irresponsible idiots, colossal idiots, another mayor chastising rule breakers there. And the president of Campania region has a stark warning.
Mandiamo I carabinieri.
We'll send armed police, he says, and we'll send them with flamethrowers. I think it might be time to listen. Well, again tonight, we are taking your questions, but we want to start with something a little bit different. It's a passionate and sobering wake-up call from an emergency room physician here in Toronto. Now, earlier on The National, we heard Dr. Jennifer Tomlin call for more Ontario businesses to shut down. And now, for the record, she explains why Canadians must heed the call to stay home.
Because there is community spread now. We know this for a fact. You have to assume that every single person you come into contact with is positive. Like, you just have to, because we are not testing people. We can't test people. So the numbers that are being reported every morning, every night, that is falsely reassuring to everybody. Those aren't the number of cases that we have in our province or in our country. There is a ton more. We just don't know it. We are about 3 weeks behind Italy. Life is not going on there. In fact, thousands of people are dying. So life is going to go on, hopefully, but not in the way that we're used to. And we actually have to get our heads around that and subscribe to it. It is our duty, it is our job to protect our population. We don't have the tests. I think the public is now realizing that. Our numbers have dropped off a bit, but now it's the calm before the storm, and the storm is coming. All the sick people that have COVID-19 are going to start to come in, and they are going to tax our healthcare system tremendously, because the people that just have regular heart attacks and strokes and appendicitis and all the other normal emergencies, they're going to still come in too. We have to conserve resources. We can't have everybody getting COVID-19 at the same time.
So with me again tonight and listening in on what we just heard, Dr. Alison McGeer, an infectious disease specialist with Mount Sinai Hospital in Toronto, and Dr. Lenora Saxinger, an infectious disease specialist at the University of Alberta. And as I said, you were both listening to that. What did the two of you think?
I think I'm a little bit more hopeful than Jen that we might be bending the curve and that we're not about to see an explosion. But I don't know that, and I would echo her plea. I think you've probably heard it from everybody now, if you've been on the news, that we need people to be physically distancing themselves from other people. We need everybody to be doing everything they can to slow the curve of this virus. If a week from now my hopes are right and we're doing a little better, then we can talk again. But at the moment, every single one of us just needs to be doubling down on not doing the things we don't need to do, not coming into contact with people we don't have to come into contact with.
And I would actually support that very much. I think that any unnecessary contact right now could result in, honestly, based on the literature, thousands to tens of thousands cases later if someone is actively able to spread virus. And so the precautionary principle is you want to do all the right things up front. And so I think what I heard from that Emerge doc is very much what I'm hearing from my colleagues here as well. And people have to take this absolutely seriously.
Well, if people do take it seriously, then this next question that we've got may be one that more and more people will ask. So here we go. How safe are deliveries of any kind? So we're talking packages, but also food. Dr. McGeer.
Again, you know, the issue is people, not things, okay? You're in more danger getting close to the delivery person than you are accepting the package from the delivery person, because it's fresh droplets from people that are the problem, and maintaining physical distance from people is more important than worrying about fomites. Having said that, you know, get delivery in, take it out of its container, clean your hands, and then you're fine.
All right. Dr. Saxinger, here's the next question for you. A lot of people wondering where the light at the end of the tunnel is. Should I just assume school is canceled for the rest of the school year?
Honestly, I think that people should make that assumption and plan accordingly. If things normalize more quickly than we expect, that would be lovely. But I think that it might be not highly likely. So I think people should plan for the long haul with the current situation.
All right. Dr. McGeer, which is safer, public transit or taking a taxi or an Uber?
Well, that's a really interesting question. And it depends a little bit on how long your trip is, and who else is on the subway and in the Uber. If you have the misfortune to get into an Uber with somebody who is infected but doesn't have symptoms, then you might get more exposure to them. If you get on the subway, obviously you're likely to come into closer contact with more people. So averaged out, taking an Uber is probably safer, but once again, we come down to don't take trips you don't have to.
Okay, Dr. Saxinger, here's another question. Can you be infected through an open wound, like a cut in your hand?
No. Well, essentially, no. I guess we should never say never, but really this is a virus that's spread through respiratory droplets. So contact by inhaling, by oral, nose, and eye exposure to contaminated hands would be the main mode of acquisition, and there would be no suggestion that skin-to-skin contact of any kind would be a risk.
Okay, we've got time for one more question. Dr. McGeer, is cash safe to handle right now? And I know you talked about fomites just a few moments ago.
Well, you know, if you clean your hands after touching it, absolutely. But I totally get the fact that everybody's worried about everything, and I'm sympathetic to it. And so, you know, if you live in Sweden, Sweden's a cashless society. And so I do think that in the interests of just the anxiety of everybody who's working in our essential stores, our pharmacies, our grocery stores that need to be open, I think it's a kindness to them if we all start using, you know, credit and debit cards.
Dr. McGeer, Dr. Saxinger, thanks so much for both of your time.
You're welcome.
Now, as we've mentioned, we will be asking your questions about COVID-19 every night going forward, so send us your questions. You can message us directly on Instagram at CBC The National, or you can send us an email at thenational@cbc.ca.
Today, we learned 5 people in the Mohawk community of Ganawage, Quebec, have COVID-19, among them a hospital worker. Canada's Chief Public Health Officer has warned Indigenous communities are particularly vulnerable right now. As Cameron McIntosh explains, there are concerns many are not ready.
It's not a total lockdown, at least not yet.
Where are you coming from? Winnipeg? You want to write down the time that they came through?
Straddling the Manitoba-Ontario border, Shoal Lake 40 First Nation is restricting access. Community members, suppliers, invited guests.
All right, you're good to go.
And emergency personnel only.
Just trying to keep everyone safe, and we don't want the sickness to get here. How are things going?
Chief Vernon Redsky says it won't stop a virus, but he's hoping to slow its arrival.
We're trying to do our part.
This is going to be going on for a long time.
Right now, he's basically running the community from his truck, trying to prevent an outbreak.
What we'd be asking for is all the necessities that are required to stay safe.
It's not just Shoal Lake 40. Those concerns are being shared by First Nations and Indigenous communities across the country, where poverty, overcrowding, and lack of medical facilities are only adding to the danger right now.
We are going to be sending money.
Earlier this week, the Prime Minister announced $305 million for First Nations.
The biggest concerns are making sure that the resources that have been announced get out to them.
National Chief Perry Bellegarde says you only need to look back 10 years when H1N1 hit First Nations hard, especially remote northern communities.
There has to be a very strategic and focused strategy to make sure that those needs of those particular communities are met.
Like Bellegarde, Red Sky's main concern is how quickly that aid money will funnel down. In the meantime, they're getting ready here.
If we have to do that to quarantine somebody, we can do that.
Making plans to use public buildings like the arena as care centers. Many here have already self-isolated.
If it weren't for people like that, I think we'd be lost.
Knowing they'll need more than a checkpoint to keep the curve flat here. Cameron McIntosh, CBC News, Shoal Lake 40 First Nation.
Next, on the National, Donald Trump says he is hopeful a malaria drug could treat COVID-19. But the experts?
I can't emphasize strongly enough, this is a dangerous drug in the wrong hands.
The mixed messages that could be putting lives at risk.
You may have heard about an old malaria medication being studied in this new COVID-19 crisis, possibly to be used in the future as treatment. But as the CBC's Vicodopia tells us, there are warnings too.
A couple ended up in this hospital after they each took a teaspoon of an old aquarium product they had. It contained chloroquine, which the couple heard the U.S. president talking up to potentially treat COVID-19.
At my direction, the federal government is working to help obtain large quantities of chloroquine.
The woman, who doesn't want to be named, says the toxic effects hit them hard. Her husband died.
Yeah, within 20 minutes, dizzy, hot. I started vomiting. My husband started developing respiratory problems and wanted to hold my hand.
Chloroquine was used for malaria during the Second World War. A less toxic derivative is hydroxychloroquine, which is prescribed today to also treat rheumatoid arthritis and lupus. It's now in clinical trials to treat or prevent COVID-19. But this toxicologist warns little is known about using it for the coronavirus, and in high doses it can cause heart problems and even psychosis.
I can't emphasize strongly enough, this is a dangerous drug in the wrong hands, and the right thing to do is to wait and see what the science says.
Some of that science is underway in Toronto in a clinical trial. Researchers will see if hydroxychloroquine protects healthcare workers from getting sick as they see more cases of COVID-19. Lab tests suggest it could stop infected cells from replicating, but that needs to be tested in people before it can be prescribed widely. That's according to the specialist leading the trial.
Because it's a repurposed drug, we have a lot of evidence on its safety in pregnancy, breastfeeding, and a variety of conditions. So again, it gives us some confidence to test it in these high-risk frontline workers.
There are dozens of other potential drug therapies and combinations being tested as possible treatments for COVID-19. At this point, none of them are approved. Vicodopia, CBC News, Toronto.
And when we come back, we look for some of the lighter, kinder moments out there.
Lean on me when you're not strong.
Yes, we've been forced apart, but in some ways we're closer than ever. That's right after the break.
Welcome back. As people take to heart the need for widespread social isolation, this temporary move away from each other has revealed a seeming paradox that distancing is somehow bringing us together. Joanna Remiliotis looks at a collective experience for Canadians who've never had to share such a strange and dangerous moment in time.
Stay home. engage in social distancing, protect yourselves, protect our system, and let's get through this strongly as a country.
The call to stay away from each other grows more urgent by the day, and as a new normal descends, it can feel so solitary. And yet, we're all alone, together.
See?
People are sharing the same moment in time.
So that's to make sure you're staying far enough apart, right?
Exactly.
Any way they can.
So when you can get together with your neighbors, makes us happy.
The good is you realize the value of community.
Community is being redefined by the day. Messages of solidarity, they're everywhere you look. In Halifax, a welcoming door of a different kind. In St. John's, teddy bears in windows to cheer up the children. And in Toronto, a mother sets up a regular walk and wave so her children can still see their friends. While a condo community meets on their balconies. From her balcony in Halifax, Kaylee Dimmick holds live dance events just to make people feel better.
I think there's a mass collective empathy. There's a lot of tragedy surrounding this, but there's also, I think, a lot of beauty that's showing itself as well.
Well, there's a virus going round, there ain't no...
John Muirhead is losing live gigs, but already paying it forward.
FaceTime if you're alone.
The songwriter recorded a new album in his home in London, Ontario, called Stories from the Quarantine, to raise money for local artists and mental health.
It definitely feels like we're part of something bigger here. It seems to really be bringing people together, which is strange as it's, forcing us to isolate.
We are here for you.
But while many isolate, others have to band together.
We are all family.
Like this ICU team at St. Michael's Hospital in Toronto.
And please, if you can, stay home.
I'm going to ring the bell.
From her home, a retired nurse rings a bell to support all frontline healthcare workers. And restaurant owner Thomas Ha delivers free meals to emergency staff.
It's a small act, but to be able to play a small part in brightening up their day or making them, have a few moments of joy and things like that, it does mean a lot for me and my team. And while a woman serenades strangers just because, every small act is yet another reminder we are in this together. Joanna Bermeliotis, CBC News, Toronto.
Up next, our moment. But first, we wanted to show you a bit more from Joanna's story, a message from an ICU team in Toronto.
We are united to give you the best possible care.
To maintain your dignity.
To fight this and keep you safe.
Hello, Internets. It's Pluto here, and I'm getting the feeling that there's a time of crisis for the two-leggeds.
So that is Pluto, offering some wisdom of sorts and much-needed comedic relief to millions around the world. And Pluto, the schnauzer, is a she, by the way, and a Canadian. And her videos are hitting people right in the funny bone, which is exactly why so many keep watching. Because in times of stress, a little laugh goes a long way. So that is our moment.
I heard that there's a crisis with the toilet paper, which I don't understand.
The Pluto videos have been going on for a little while, just within my group of friends. I don't normally do public posts, but I thought, okay, I'll make it public. And when it passed 1 million, I'm going, I don't even understand this. It's actually quite emotional, some of the messages we're getting, because people are saying they just are having such a hard time, and she is just their day. Actually, a lady in Rome was telling me she was just beside herself with anxiety, and this video popped up and she laughed for like the first time in a week. What else can we do? We have to just keep doing it. She's now an influencer and a pandemic spokesperson.
She is. And these are fantastic. So if you get a chance, look them up. But also she's getting, Nancy says she's getting, the people reaching out to her mostly are healthcare workers saying thank you and keep it up because it's a break.
And I just love how apparently this started as just a goofy way to wish her friends a happy birthday, and then it just kind of took off from there. That's The National for this March 24th. Have a good night.